Osteoarthritis. There is a debate that osteoarthritis is a disease or is not a disease. Osteoarthritis, if you want to understand in just very simple language or simple sentence, is aging of joint. That's it. If you understand this little phrase that is equal to osteoarthritis, it will solve so many problems. Then you understand everything. So osteoarthritis is aging of the joint. What does that mean? It means when you are young, your joints are young. When you start using it, what happens? The joint is slowly getting older. And when I say getting older, it means what? It means this. The bone and bones, this is one bone, this is another bone. So when they move, they're not supposed to touch each other. Anytime one bone and the other bone touches each other, that friction will cause pain. That's why the designer of the body has put one little layer of cartilage between every two bones they want to move. This little layer of cartilage doesn't have any pain receptors. Because it doesn't have any sensation, any pain receptors, when you move it, you don't feel anything. You see, it's so beautiful design. So, but when you use this joint for 50 years, 60 years, 80 years, what happens? This cartilage, which we call it articular cartilage, becomes what? Becomes narrower and narrower and narrower until the bones touch each other. When the bones touch each other, the movement becomes painful. Because you keep moving and you're causing pain, and that is also damaging the area, it causes the swelling sometimes. So these patients, sometimes they have swelling when they use the joint so much, on top of the pain they have. This is called osteoarthritis, or we call it degenerative joint disease. Makes sense. There is a degeneration of the joint. Degenerative joint disease. So technically, if you want to know the simple language understanding of osteoarthritis is aging of the joint. If you want more medical terminology, means what? It means narrowing a what? Narrowing a what? Or thinning, erosion. Erosion or narrowing a what? Of articular cartilage. Does that make sense? You remember I started with this, I said like there is a debate, osteoarthritis is a disease or is not a disease, meaning this, if we age to 100-year-old, all of us, we have some degrees of osteoarthritis. So it's just normal aging. So it's a process, it's a part of your aging process. Does that make sense? That's why we don't know if it's a disease or not. There are two types of osteoarthritis when we look at it. One we call it primary. One we call it secondary. What is the difference of these two? The secondary is more closer to definition of disease than primary. What is primary? What is secondary? I'm waiting for answer. You don't know? Shame on you. So primary is when the aging of the joint is happening because of aging. It means the normal population in about the age of 70 or 80, they will have some degrees of degeneration in their knee joint, some degrees of degeneration in their hip joint. Does that make sense? That is primary. It means the only cause of that is aging. But just imagine, I overuse my knee joint. I'm a runner. I overuse my knee joint every day. Crazy running. When I'm 30-year-old, my knee degeneration will be equal to a 7-year-old. You understand that? That is a disease. Because what did I do? I made it much faster, this process. So it's not a primary anymore, it becomes secondary. So I did much faster. So primary is what? Is due to what? Due to aging. Well, what is secondary? Due to what? Due to overuse. Beautiful. Due to overuse. Secondary happens in any area you overuse. So you make it much faster, the process, than a normal aging process. You know what I mean? So what are the examples of secondary osteoarthritis? Examples. Let's say I'm a tennis player every day professionally, not just 1 hour per week. If I play 3 hours per day, every day, I put too much pressure on my elbow joint. What's going to happen? We're going to have what? I'm going to have elbow osteoarthritis in tennis players. You see that? You see that? What else is common? Let's say, I just said that runners, they have much faster of runners running too much faster knee damage, right? Knee damage. The other example is if you're a girl and in young ages you love to wear high heels, right? But just imagine you wear, like models, wear high heels every day for 8 hours, for 25, 30 years. You know, you put too much pressure. All your body weight, instead of going to the heel, will be transferred to your big toe. So your big toe is doing the job of the whole heel. As a result, what happens? Your big toe becomes what? Becomes degenerated much faster. You know what I mean? So models, they have what? Models, they have what? They have a big toe degeneration much faster. You understand? If your leg is shorter than the other one, let's say you have one leg shorter than the other one, the medical word is a leg length discrepancy. Leg length discrepancy. If one leg is shorter than the other one, so you normally put more weight on one side compared to the other side. So the side you put more weight on it, usually the hip joint and knee joint, there is more chance to get degenerated compared to the other side. You see? These are the very good examples of secondary osteoarthritis. But primary is happening due to aging. The other question they ask you, they say, the secondary is clear. Anywhere of your body you overuse it, you will have more chance to get it, right? But how about primary? If I'm a normal person, I don't overuse any part of my body, and I will continue living. By the age of 70, 80-year-old, I will have osteoarthritis in some areas of the body. Everything's okay? I will have which areas are more common? This is another question they ask you. The primary osteoarthritis or degeneration of the joint is more common in which areas of the body? I will show it to you right now. The primary osteoarthritis, which is a normal aging process, which will happen in all of us, if you are lucky enough to age up to 80, 85, is more common in some areas only based on the structure of the body and the posture of human being puts more pressure in some areas compared to other areas, which is more logical. What are these areas? Number one, knee. Because you put so much weight on the knee, very commonly old people, they get osteoarthritis of the knee. Hip joint, another one. You have heard so many people, they need to have the replacement of the hip joint in older ages. You know? So they always have pain in the hip joint, so like that. But right away you say hip joint and knee joint are commonly gets old or gets degenerated because of weight, right? But what is the base of the body is actually ankle joint. Make sense? Totally opposite the way you think, ankle joint is not commonly getting degenerated. It takes much longer than these two joints. The reason is because of the special structure of the ankle joint. It's a beautiful angle of it. It will distribute the weight so it doesn't put too much pressure directly on the joint because of those small bones there, the talus and calcaneus. So we don't really have commonly ankle joint degeneration. So, but the hip and knee are very common. So let's go back to the low back area. In the low back area, because all your body weight, the trunk weight, the chest and abdomen, drops on L4, L5, S1 area. That area commonly gets what? Degenerated as well. So the low back area, when I say low lumbar area, what does that mean, low lumbar area? Means what? Means in L4, between L4, L5, between L5 and S1. You see that? So that area also commonly we have this degeneration. How about the neck area? The same story because you put the weight of your neck 70 years. on your base of the neck, which is what? Which is the lower cervical area. Right? Such as what? Such as C6 area, between C6, C7, between C71. That area also gets commonly degenerated. Another very common area gets degenerated are what? Are human being using hands a lot. Okay? Opposite to animals. So human being using hands a lot for 60, 70 years. You see all the old people, they have some sort of degeneration in the joints of the hand. Multiple joints. Depends on which joint they use more. Massage therapists, they use thumb so much. So there is a chance if you do friction, if you do kneading with the thumb, you have degeneration of the joint much faster than other joint. If that happens much faster, that goes to the category of secondary actually, because you overuse it because of your occupation. Okay, so that's a different story. But normal people by the age of 80, 90-year-old, because of using the hand during the 90 years of life, so they have, so all the hand joints, that's why I write it as a general thing. It could be wrist joint, it could be finger joint. So these are the major joints. They are more commonly get into the osteoarthritis or degenerative joint disease, or OA. You might see it in different shapes and names, this disease.